Hello, everyone. My name is Felicia, and I will be presenting on youth mental health. So here's just my table of contents on what we will be going over during this presentation. So mental health can impact every aspect of a person's life: how we feel about ourselves, how we see the world, cope with stress, and overcome challenges. Mental health encompasses our social, psychological, and emotional well-being. Poor mental health can affect a youth's grades in school, decision-making skills, and overall health. Mental health disorders also go hand in hand with other health problems and risky behaviors, such as substance abuse and higher risk sexual behaviors. It is important to talk to youth about mental health because good health habits are established in the adolescent years and carried throughout their adult lives. According to the CDC, social determinants of health are conditions in the places where people live, learn, work, and play that affect a wide range of health risks and outcomes. There are 4 determinants of health that I'm going to talk about that affect youth mental health. One of those social determinants of health are low-income households. Low-income households can put children at risk of developing mental health disorders. 21% of children ages 6 to 17 from low-income households have a mental health disorder. 57% of these low-income youth come from households at or below the poverty level. Race and ethnicity can also play a large role. 88% of Latino youth have unmet mental health needs, as well as 13% of children of color receive mental health services as compared to 31% of their Caucasian peers. The child welfare system, also known as the foster care system, and the juvenile justice system can put children at higher risk of developing a mental health disorder. 50% of youth in the child welfare system have a mental health disorder. Up to 70% of youth in the juvenile justice system have been diagnosed with a mental health disorder as well. Those in the child welfare system are also at an even higher risk of developing a mental illness, such as post-traumatic stress disorder, if they are in the foster care system due to abuse and neglect. Youth with physical and cognitive disabilities have higher rates of mental health issues than their peers. Children with autism spectrum disorder are more likely to experience depression and anxiety, as well as youth with learning disabilities have an increased risk of severe depression and suicide. As many as 1 in 4 youth meet the criteria for a mental health disorder. As you can see, mental health disorder affects a large number of youth. Even though the highest rate of serious mental illness is technically in adults ages 18 to 25, pediatrics can see patients up to 21 years of age, so this is important to keep in mind when treating our older pediatric population. 50% of mental health disorders can occur by the age of 14. This is very important for pediatric providers to be aware of and to screen patients early so that they can get the help that they need. One impact on healthcare is the cost of treating those with mental illness. We are spending billions of dollars to treat mental health. In 2019, healthcare spending on mental illness reached $225 billion. This is a large increase in just the 10 years from 2009 to 2019. Integrating behavioral healthcare services into primary care settings has been shown to reduce the total cost on the healthcare system. Although I am curious what the statistics are from 2019 to today, as we have seen a rise in the need for mental health care since the pandemic has started. Another impact on healthcare is unavailable resources. Our emergency departments are already overwhelmed with physical health problems, especially since the pandemic. And now there has been an increase in patients being seen in the emergency department for mental health problems. From 2019 to 2020, there has been a 31% increase in mental health related visits to the emergency department. These ERs do not have the resources or the training to treat those with mental illness, and this increases the overall demand on ERs in an already overwhelmed healthcare system. Mental health can affect any part of the population. The age at which children are diagnosed depends on the specific mental health disorder. Here are some risk factors for developing a mental illness, such as low self-esteem, single-parent households, sexual abuse, and poverty. As you can see, there are a wide range of risk factors, and while these are not a guarantee that these risk factors will automatically lead to a mental illness, they can play a large role in its development. While there are factors that put many at risk for developing mental illness, there are protective factors that are associated with lower rates of mental health issues. I did want to include these factors, such as supportive relationships in family members, clear rules and boundaries, and physical and psychological safety, but it is important to note that a person can have all of these protective factors and still have a mental illness. Here are goals when working with youth with mental health issues. The greatest opportunity of mental illness starts with prevention in children and adolescents. The goal of preventing and treating youth with mental illness is strengthened in the child's ability to regulate emotions, encourage alternatives to risk-taking behavior, the ability to manage difficult situations and adversity, and promote supportive social environments and social networks. Early intervention is key, and we want these kids to lead happy, successful, and productive lives. I am going to talk about evidence-based interventions in 3 common mental health diagnoses in adolescents: depression, anxiety, and ADHD. So let's first start with depression. The very first thing that needs to be asked when dealing with depression is about the patient's safety and their suicide risk. This also needs to be continually reassessed when treating patients with depression. The family also needs to be involved in the treatment, as they are the ones with the patient the most and can identify signs of decline in the patient's mental health. There are 3 types of treatment options, which are pharmacotherapy, psychotherapy, and combination therapy, where you combine the 2. The treatment of depression depends on the severity, duration, comorbidities, and response to treatment. The preferred pharmacotherapy for adolescents are SSRIs, such as fluoxetine. Cognitive behavioral therapy is the preferred psychotherapy, where the frequency is also determined by the severity of the depression. For those with severe depression, cognitive behavioral therapy and an SSRI are recommended. When treating patients with antidepressants, it is very important to inform the patient and the family that it can actually increase a patient's thoughts of suicide and depression. The patient should tell the family and the provider right away if depression or suicidal thoughts increase. Here are interventions from UpToDate on how to treat anxiety. Treatment does depend on the severity of the anxiety and their comorbidities. For mild to moderate anxiety, cognitive behavioral therapy is recommended. For severe anxiety, SSRI and cognitive behavioral therapy are both recommended. When there is co-occurring anxiety and depression, combination therapy is preferred. If combination therapy is still not effective, a second SSRI can be added. There are interventions for ADHD from UpToDate. The interventions are based on age because the medications for ADHD are not FDA approved for all age groups. Therefore, behavioral therapy is the first-line treatment for those ages 4 to 5. For children 6 years of age and older, initial treatment is a stimulant medication along with behavioral therapy. Dosing of medications depends on the severity of the ADHD and how it is working for the patient. Patients undergoing treatment for ADHD should be monitored frequently for adverse effects in response to therapy. There are targeted goals for children who have ADHD. These goals need to be realistic, achievable, and individualized to the patient. Examples of those are improved relationships among parents, siblings, teachers, and peers, improved academic performance, and improved adherence to the rules in school and at home. A gap in the literature for mental health is the transition between pediatric and adult mental health services and the disruption this care brings. As we have talked about before, the rate of serious mental health disorders is highest between the ages of 18 and 25. This is at the same time that teenagers and young adults are switching between their pediatric providers to their adult providers. There is a lack of literature on how to make this transition easier, as well as a lack of resources these now adults need to be successful. Here are screenings that the American Academy of Pediatrics recommends that are related to mental health. Psychosocial and behavior should be screened at each and every well check. Substance abuse and depression should be screened every year, starting at age 11 and 12 respectively. One screening that may not be thought of in pediatrics is the maternal depression screen. While the parents are technically not our patients, they are caring for our patients, especially our young infants, at the same time when postpartum depression and anxiety can happen. We want those mothers to be in a healthy mindset so they can care for their children, or then we can intervene to get them the help that they need. Here are mental health screenings that can be used by nurse practitioners. The DSM-5 contains screenings for depression, anger, anxiety, and more. The PHQs contain multiple questionnaires to assess mood, anxiety, disordered eating, and alcohol use. As well as the Vanderbilt Assessment Scale is used for both parents and teachers to assess for ADHD, ODD, depression, and anxiety. Here are some resources for those struggling with mental illness. The CDC and healthychildren.org is a great resource for parents with questions or needing information on a wide variety of topics, including mental health. The National Alliance on Mental Illness, also known as NAMI, is a national organization that supports both parents and families with a local affiliate right here in Toledo. The National Suicide Prevention Hotline is available 24/7 every single day of the year for those in a suicidal crisis or emotional distress. This hotline is also accessible for those with disabilities, which is important because we have talked about those with disabilities being at a higher risk of developing mental illness. One ethical consideration is the patient's autonomy. Providers make decisions based on what treatment they deem best suited for the patient while still respecting their autonomy. This becomes an issue when the patient is at harm to themselves or others. There is legislation that allows patients to refuse treatment, except when the concern is for self-harm or at-risk harm to others. This may include involuntary hospitalizations. This is all in the best interest of the patient, so they do not hurt themselves or others. However, sometimes if patients are at risk, they may be held against their own free will, which can pose an ethical dilemma. Here are some challenges to youth seeking treatment for mental health and for the providers who are trying to treat those with mental illness. One challenge is a stigma. There is a huge stigma around mental illness, which does prevent people from getting the help that they need. There is also the challenge of accessible treatment. Like we've said before, there is an increase in ER visits for mental illness-related healthcare needs. However, ERs are not equipped to help these children, and there are also long wait lists that may take months for patients to get into the therapies that they need. There is also a huge financial burden. Healthcare in the United States in general is very expensive, especially for those who do not have insurance. These can all deter people from getting the help that they need. Mental health plays an important role in every aspect of a person's life. Poor adolescent mental health can impact a child's peer and family relationships, quality of life, and performance in school. As many as 1 in 4 youth meet the criteria for a mental health diagnosis. Proper diagnosis and treatment can improve a child's quality of life and lead them to become successful adults. It is crucial for APRNs to be an advocate for youth with mental health disorders and provide the help and resources that children need to live happy and healthy lives. And then here are just some resources that I have used to form this presentation. And that concludes my presentation on youth mental health. Thank you for listening.